Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Hello, and welcome to our podcast series on the power of positive thinking. I'm Dr. Candace Pierce with Elite Learning by Calibri Healthcare, and you are listening to our Elite Learning podcast, where we share the most up-to-date education for healthcare professionals. I am so very thankful to welcome back Dr. Erica Ramey for this discussion. Erica, thank you for taking time to share your expertise with us.
I'm glad to be back. Thank you for having me again.
Absolutely. So in this series, Dr. Erica Ramey and I, we're going to talk about positive thinking. And I really want to point out that it's not just a feel-good concept. It's actually a really powerful tool that's going to transform both the practitioner and patient outcomes. So we'll take a deeper look at some evidence-based approaches that show how our mindset really does influence everything from therapeutic alliances to treatment effectiveness. But I do want to be very transparent that this is not about toxic positivity or denying the very real challenges that we face. So as healthcare providers, Erica and I can both attest to those challenges. So
Absolutely.
instead, Erica, we are going to explore practical, sustainable ways to really cultivate resilience and optimism in our practice. So Erica, to get us started.
Yes.
What is positive thinking and how is it really defined in psychological terms?
So I definitely appreciate that you pointed out that we're not talking about toxic positivity, which is what I think some people automatically think of. And we don't want to do that. We don't want to frame it in that way. When we are talking about positive thinking in healthcare, really, we're talking about focusing on constructive solutions. We are remaining hopeful when things are very stressful, and shifting to that sort of mental framework allows us to view obstacles more as opportunities. It helps us to be a little bit more resilient, and it helps us to function better in stressful or overwhelming environments. So we're really talking about just reframing our approach to stress or problems and things we encounter in the healthcare field.
Absolutely. And I was thinking about this before we met today, but I was thinking when I'm sitting in a report, sometimes I don't realize this, but even just in my connotations of when I say things and how I say them to other people, kind of take that positivity off of whatever it is that I'm talking about, specifically patient outcomes. So if I'm giving a report and I'm like, well, the patient in like room 350, Mr. Jones. And that heavy sigh that you start after that. Yeah. And you're just
nah, Mr. Jones. Yes.
Yes. And so I really feel like that removes some of the positivity towards that patient. And so people start to view that patient maybe as being a more negative patient. So that really can affect the outcome of that patient, right?
Absolutely. And we're taking our own negativity in that case and we're passing it on to the next person. So we're doing even more harm than if we just had a negative outlook. We're actually trying to spread that negative outlook. And I like your example with report. And it's something I see in academia as well when we're discussing maybe a student that's struggling more. So it's kind of taking our own frustration and then encouraging the next person to share in that misery with us, right? Oh, well, you're going to get so-and-so. It's been an awful day. Good luck tonight. And so we're asking them to just be as unhappy as we are, instead of reframing it with, well, so-and-so has struggled with this today, but here's what we've changed in the treatment plan, and, offering a little hope to our colleague at shift change rather than the promise of 12 more hours of misery. So
right. And it's true.
Very damaging.
Misery, they say misery loves company. And, we see that. We don't want to be alone in our misery, but we also don't want to be alone in our positivity either.
Right. Right.
So,
And both are contagious. It's just so much easier to pass on the negativity because the positivity takes a little bit more effort. It takes some maturity and self-awareness to be able to take a step back and reframe and pass that on. Whereas anyone can be negative. It takes no
mhm.
skill to be grumpy and negative. And it, kind of it's the least amount of effort and tends to be the practice we perpetuate the most,
It,
unfortunately.
so basically, what I hear you saying is it's easier to be negative than it is to be positive.
Absolutely. You don't have to
I
be fully awake yet, even. You can just pass the negativity right along
There you
before you've
go.
even had coffee. Yes, very much so.
Oh, so true. So I shouldn't talk to my kids before I've had coffee. Got it.
10 a.m. ish is a good time, I think. Yeah,
Yeah.
about right now.
That's
Yes.
a really good point. I used to say it was funny when I was in college. I worked in a pharmacy as a pharmacy tech, and there was one particular pharmacist that I would work with, and we did not talk to each other until about 10 o'clock. We just
So
did our own
that's
thing, and we knew at like 10 o'clock. All right, we're
Then we're
good to
ready.
go.
Then
Yeah.
we're ready. That's a good example of knowing your team, knowing your
Hmm.
team members. I know in one of the teams that I'm a part of, we intentionally schedule our weekly meeting for 11:30
Mm.
because that gave everybody time to get in, get settled, catch up on some things, and then meet. So that's a
Wake
great
up,
example of
get
working
some
with the team you're
coffee.
given. Exactly, exactly. Be fully awake. Yes.
Absolutely. I do think that's important. I need to be fully awake and able to
Yes.
comprehend what you're saying because I'm not meaning to be negative when I'm like, what did you say? I have no idea what you said. Like,
Can you
um,
say that again? Yes.
exactly. Are you speaking English? I don't know.
Mhm.
What are the key principles and components that are necessary for positive thinking?
So, when we think about positive thinking, again, as I mentioned earlier, we're really sort of looking at reframing our situation. So,
Mhm.
you want to consider gratitude. So, sometimes it's just taking a step back, reflecting on where we're at, what is going well, perhaps in the middle of a difficult situation. Uh, what are you thankful for? What components of your healthcare team, for example, are you thankful for in the middle of a challenging situation?
Mhm.
So, gratitude, resilience, which is, of course, our ability to kind of bounce back or press forward when things are very difficult, and a lot of self compassion. So,
Mm.
a lot of acceptance and self awareness, but then the ability to be compassionate with ourselves so that we can pass that compassion on to our patients, our
Mhm.
coworkers, and the people on our team with us.
It seems like when you're talking about that, it's also, you were just saying knowing your team. And so having
Mhm.
those same attributes towards your team members, knowing when they're struggling so that you can step in and kind of give that affirmation to whoever it is that you see struggling. I see that as like maybe a leadership, positive thinking
Right.
skill.
And the benefit of the doubt there for our coworkers as well.
Hmm.
We have some posters up where I teach on the wall in different learning areas of the school, and it says essentially we start with the basic assumption that
Hmm.
everyone there wants to do well, is intelligent and competent, and we all want the best outcome for our students. So just giving each other, and in the healthcare setting, giving each other the benefit of the doubt that we all want to do a good job, we all would like to do our best. We
Right.
just may not have what we need, or the situation may be more challenging, but just kind of giving each other the basic assumption that we do want to do well, that we all kind of want that same thing in our work environment. And so giving your team members that benefit of the doubt can help us not be so negative with each other and
Right.
can help us approach the problem for what it is and not our coworkers as the problem. Which
That's,
that alone can help with positive
yes.
thinking.
Absolutely. And grace is really huge in that. And I feel
Yes.
like that also, as you were talking about positive thinking, providing that grace towards people who make mistakes, who mess up,
Mhm.
or, I have a thing whenever I'm teaching my students where, and I don't announce it to my students, but I will give grace to every student for one late assignment because life happens,
Yes.
you know?
Yes. And
And
I think it's easy on a day where maybe we're doing okay, to forget that maybe yesterday we were the one struggling or turning in something late or not giving 100%.
Right.
And so reminding ourselves, that's part of that self-awareness there, where we want to remember we fall short. And of course, so do our colleagues, so do our students, and having that appropriate self-compassion, again, to pass on that compassion to the people that we're working with.
Absolutely. That's really good. So, how does positive thinking influence our mental health and our emotional well being?
Right. Well, positive thinking in the literature is associated with more resilience, which we've already mentioned as a key feature. It's actually better for our relationships when we have a more positive approach. Again, the basic assumption that others intend well or mean well aren't
Right.
out to get us, that benefits our relationships. It's associated with better stress management as well at home and in our careers, lower burnout, right? We're less burnout if we approach the work that we do with a positive mental framework, higher job satisfaction, all these things that we kind of could say that makes sense, right? If we're
Right.
approaching it with a positive mental framework, then there's more optimism, better coping skills, we're more adaptive. So it really allows for cognitive flexibility that benefits our work and our relationships.
Absolutely.
So, the evidence is there.
It really is. And it's so interesting to me how we tend to go more towards the negative thinking, and we have to work. And it's almost like it's a there's a specific word I'm looking for that I can't find out of the air right this minute. But you continue to practice something, and then you become, you know, um, basically an expert in that area. So it's something that you
Sure.
just have to keep practicing and practicing in order for it to become a routine. That's the word I was looking for.
Routine,
A routine.
automatic. There were so many great words there. Yes. I didn't know which one you wanted.
Yeah, I was looking for one of those. But, I read something somewhere probably a long time ago that it says it takes um, getting to do something a minimum of 40 times before it becomes a habit, a routine,
Sure.
something that you don't have to think about doing anymore. You just do it. Like getting up early, I can't make it past like 2 days of that. I'm trying to make that a routine. I just haven't got up to 40 in a row yet. I'm still
That's
working
a
on
lot.
it.
Well, I think the weekends might be throwing you off. You could probably do it 5 days in a row, but then come
Exactly.
Saturday, yeah.
Sleep
No,
late
that's
day.
very true. That's something I share with my patients as well. Anytime they are working to develop a new habit or really become more proficient with a particular coping skill, the first few times it's going to feel very unnatural. It's going to feel forced, and you're not going to be so sure about it. But the more we practice that, reframing things or
Yes.
choosing to be more positive, the more we practice, the more it will become automatic, and it won't feel so forced. It will feel like our natural train of thought. And we
Right.
can oftentimes see our emotions follow our thought processes. So very helpful for us from a mental health standpoint as well.
And it becomes more genuine. I know in the beginning it probably doesn't feel, especially if it's outside your norm, it's not who you have been, because we can
Right.
change our character and people will be like, what's wrong with her? She's being
Right.
really
What's
positive
going
today.
on? Yes.
But the more you do it and it becomes your thought process, the more it becomes really genuine, and people see that genuine change in your character, basically, because that's what it is. You're changing your character in a sense.
Absolutely. And you are more positive. If you're constantly working
True.
through things with a positive mental framework, you are more positive, which will make you more happy in
Yes.
in the day-to-day stressors that you encounter. And people can see that. Absolutely.
Absolutely. Oh, we said it together.
It's good teamwork. It's good
Yes.
teamwork.
Physiological benefits. I mean, I know that we've talked about mental health and emotional well-being, but there's also physiological benefits for maintaining a positive mindset, right?
Absolutely. So we can see that. I think the most commonly thought of thing is just in our blood pressure. We can actually physically, to a degree, lower our blood pressure by being calm and optimistic and walking through positive scenarios, just like we can raise our blood pressure
Right.
by inducing stress or anxiety, and we can kind of rev it up. We know that when we do practice more positive thinking, more mindfulness, we see improvement in immune functioning as well. So our immune system responds very well to that. Our cortisol, stress hormone levels
Yes.
respond very well to
Yes.
positive mental framework
I need
and
all the help
mindfulness.
with that.
All of it. We are truly more physically resilient when we practice viewing things through a positive mental framework. So positive thinking has literal physical benefits for our body, just day in and day out. And it's something that we can notice some of those benefits within minutes. So, long-term sustained effect, sure, we can see over time, but even within just minutes, we can see the changes in our blood pressure, and we can see the physical sort of symptoms. If we have immune symptoms or immune related symptoms like eczema or kind of some rashes, skin changes, migraines, things that we can see from inflammation, then the positive mental framework can help reduce the frequency of those episodes. So we have this beautiful connection between our mind and our physical body. And just like it responds to negative exposure, it responds to positive exposure, just in a positive way.
Right.
Fortunately.
It's just so interesting to me how our mind and our thoughts really do affect our health. I really don't think I started hearing conversations about this until about COVID.
Really?
Yeah,
Okay.
where it started to make those connections and really to hear people talk more about healthcare providers and like PTSD and
Right.
stress and positive thinking. And I really think it came in the self-care. They all give those self-care toolkits during
Sure.
COVID, and they're like, "Hey, now let's focus on this." And it's just interesting to me that this is not a part of the conversation earlier on. I mean, this should really be earlier in our careers, probably in nursing school, when we first are going through nursing school, to talk about what self-care looks like and how we can really have. I really think this goes back to how much joy and fulfillment that you find in your career. Because there is a lot of negativity in healthcare right now.
And I think a lot of the emphasis on that connection, with my background being in mental health, we discuss extensively the negative implications of stress with things like PTSD or trauma, like adverse childhood experiences, the big Kaiser Permanente study. So we have a pretty considerable amount of knowledge and attention that we give to the negative effects of stress. But as you're mentioning, it would be equally beneficial, if not more so, to promote resilience in nursing school and promote that self-care, and actually have faculty, and I'm speaking to myself as well, who model appropriate self-care and appropriate boundaries so that our students who then go on to become nurses themselves aren't burnout and aren't taking care of themselves, and then maybe find themselves leaving the profession because we couldn't quite find that balance there for taking care of themselves and reducing burnout. So completely agree. That's an excellent point.
And I will say, one of the things that I see on social media, especially with influencers in healthcare, and while I get that it's funny and they're being funny and having that comedic feel to their platforms, what you see modeled is you come home from work and you grab a wine bottle. You grab the whole bottle. You don't even take time to pour it in a cup. Those types of things being modeled, where I think we should take time, if you have a platform, to model, like you're saying, what it actually looks like to take care of yourself when it's hard.
Right. That's something that we saw sort of peak in the pandemic as well. So the making increased alcohol use and even some excessive alcohol use, making it funny or more commonplace, like it's moms need this and healthcare professionals need this, and personal preference and boundaries for whether you consume alcohol or not. But at the end of the day, it's not a healthy coping skill. It shouldn't
not
be
at all
our go-to coping skill. Right. And so jokes aside, it would be great if we saw healthcare professionals actually modeling how to actually practice healthy coping skills. So, do you debrief with other friends who are in healthcare and can kind of commiserate with you and kind of share in that and provide some understanding? Do you have a practice of maybe journaling or jotting down some thoughts so that you can put it aside when you get home and actually be present with your family? Or do you listen to your favorite podcast and sing really loudly on the way home so that you can shift your mindset? So when you walk in the door again, you can be present with whomever you love. So really, it would be excellent if we did have some more examples that were popular in the same way of promoting those more healthy coping skills. That'd be great. Yes.
So, can you explain the concept of the placebo effect and its relation to positive thinking?
Yes. So placebo effect, I do want to say, is still an effect. So we do benefit from placebo effect, regardless of short term, long term. There's still an effect. And with positive thinking, when we're thinking about placebo effect in general, there is some benefit from positive reframing or mental reframing, but we don't want to limit the reframing to just in that moment, just to feel good, and that be the benefit from it. So we don't want to stop there. The positive thinking should carry over to finding some solutions for the situation in which we feel that we need to implement that positive thinking to begin with. So it should really kind of be viewed as a mental framework and not just that everything is great, it's sunshine, butterflies, rainbows, but rather a tool to promote reframing. So almost a therapy skill, if you will, if we can bring in some therapy into this podcast.
Bring some therapy. I need all the therapy I can get.
Yes, because our goal ultimately isn't to just feel good in the moment or have kind of this little blip where things seem okay because it's all rainbows, I'm happy, I'm Pollyanna. The goal is to restructure how we think and how we approach complex situations, and then how we're interacting with others on our team and those in our life. So we really want a sustainable mental framework shift when we're talking about positive thinking, rather than a placebo effect or a Band-Aid over a difficult emotion.
So you're saying that you don't expect us to have positive thinking in such a way that my world is painted in watercolors and rainbows and unicorns and butterflies. Like, we do have hard times.
Yes.
But maybe it's just that shift in how we think, such as the big one that I say to my kiddos when I remind them of how they're not being unselfish is, you don't have to, you get to.
That's exactly right.
You get to go put your stuff up because you have stuff to put up.
Yes. And again, you're reframing. So you're modeling that reframing. Not only would I say that we shouldn't have our head in the sand and just pretend everything is positive. That's actually counterproductive. And what we will find is when we remove our head from the sand, our problem that we were avoiding is now bigger than it was when we went into the sand. So no, I would not encourage you to do that at all. We're just creating more problems for our tomorrow self.
Right.
Instead, it is really reframing what we have. And that's part of where the gratitude comes in, which sounds like some of what you're doing with your kiddos there. Like, it's not that you have to, it's that you get to. It's same thing. Son complaining about soccer practice. It's not that you have to, it's that we're on a team and you get to go practice with these other kiddos and you get to travel and play soccer with them. It's an opportunity and frankly expensive. So
yes, it is. I have a soccer player
you get
and I say, you chose.
That's right.
I say you get to. I say you chose to do this, and you've got to see it through.
You will. Yes. You will follow that commitment. Yes. So we don't want to blindly be fake optimistic. That's not the goal. It's about being genuinely hopeful for a better outcome. So framing it in a way that we are appreciating the good in the situation and then using that to work out some solutions to improve our outcome. So moving from there. And that can be in very small things like a conversation with your spouse or in an encounter with a patient that is maybe more difficult, or in much more complex work issues that we're running into, system issues, if you will. So it's really keeping the good and then using the negative as an opportunity for an improvement moving forward. And that's a vague way to say it, but I have to be vague because it applies to to everything. So
Right.
you have to kind of shape it for that particular situation.
And then how to shape it into your situation.
Right.
You've mentioned a couple of times the terms resilience, and we've talked a little
Mhm.
bit about stress management. But how does that reframing into that positive thinking really impact stress management and resilience of, a healthcare provider or even in our everyday life?
Right. So, our ability to cope with stress is improved when we have an exit, an outlet, a plan. I always tell my patients anxiety loves a good plan. Its favorite thing is to know we have a plan. So, that's
Mm-hmm.
really beneficial. So, if we are approaching a problem and we see or feel that it's all negative, there's nothing to be grateful for here, then we can start to feel very stuck, and that's where we experience a lot of burnout in the workplace, disengagement or disappointment in our relationships, just feeling overwhelmingly frustrated because here we
Mm-hmm.
are, we're stuck and we can't do anything about it. And positive thinking builds into resilience and lowers burnout and frustration by giving us one, gratitude. So again, we're reflecting on it's not all bad. I have good coworkers, or I really do have a good kiddo, or my spouse really does mean well, whatever our silver lining is.
Right.
And then we're not making it about the other people, we're making about the issue that we're approaching. So,
Mm-hmm.
okay, this is a good place to work. Right now, the situation, the system we have set up isn't functioning well. So I'm thankful for my coworkers. Let's approach this issue. And then we can actually start kind of brainstorming how to improve the situation that we're in. So we're never stuck, right? So we don't have to feel as burnout because we aren't just spinning our wheels. We
Yes.
have some potential outlets, some potential options, and we can think more constructively when we have that positive outlook, and then actually be more creative towards finding a solution. So it's sort of a self-fulfilling prophecy in the same way that everything will go wrong mindset contributes to things going wrong. Giving a mindset of, okay, well, there's some potential opportunities here, can start spinning the wheels for us to actually see some potential opportunity and start thinking about solutions to what we're encountering in the workplace or at home.
I really like what you said. Make sure I have it right. Anxiety exits with a plan.
Yes, it loves it. Anxiety loves a good plan. So if you're feeling anxious, if you're feeling overwhelmed, one of the best things we can do to sort of immediately reduce anxiety is to make a plan. What really are our options? What are we looking at here? What facts do we have? And then we
Mm-hmm.
start working through a plan there. And that can help just bring anxiety down because we know, okay, at the end of the day, we have a plan. We
Yes.
love a good plan. We love
Oh,
a good plan.
I do. I am a planner to a
Yes.
T. I know
Perfect.
throughout this episode, we've talked about some of the more common misconceptions about positive thinking, about how we're not saying that everything is, sunshine. And,
Right.
there are times where life is hard and life is tough. But what are some more of those common misconceptions that people have that maybe hinder them from wanting to reframe into positive thinking?
Well, one I think big roadblock to also consider is just it again, it's easier to be negative,
Hmm.
and it takes a lot more work to take a positive mental approach. Please excuse the cat. It takes a lot more work to be positive because what you're having to do is reframe and shift, and you can't just sit and complain and be uncomfortable. You have to actually be a catalyst for improvement, and
Right.
so that's very difficult. So I love that we've mentioned it's not sticking your head in the sand. It's not denying that there's an actual problem and pretending everything is okay,
Hmm.
or even pretending everything will be okay if we don't change what we're doing. So it's not saying it's going to be fine. This new electronic medical record system we're using that doesn't work, it's all going to be great. It's not that. So it's not denial of the problems that exist. It's saying, okay, this new electronic medical record system has a lot of issues. Maybe it's helpful that we keep a log of the issues we're encountering and we can bring that to the next meeting. Or maybe it's okay, well, what parts of the system are working well that we can
Hmm.
communicate to leadership, et cetera. So it's creative problem solving. It's not denial of a problem.
Absolutely.
Totally.
And maybe
Yeah.
not focusing on the problem itself, but
Sure.
focusing on what you are learning through the problem and how to fix the problem.
Absolutely. Solutions. We're very solutions focused here. Yes,
Yes.
absolutely.
Are there any other misconceptions that are common?
I would think it would be worth mentioning that sometimes I encounter with my patients some resistance to positive thinking because they might feel like their mood has to be really good first
Mm-hmm.
before they can engage in positive thinking. Whereas actually, if we can engage in the positive thinking, as I sort of alluded to earlier, we can shift our mood to sort of follow that line of logic.
Yes.
So you don't have to be happy to be positive. I will say you don't have to be calm and not anxious to be positive. We can start shifting and reframing our approach to problems, and then we can find that our mood will follow along with it. Sometimes, not always. Of course,
Right.
there's always outliers, but in general, we could approach the problem logically and then get our mood to kind of follow suit. We think more positively when we're looking at things more positively.
And I think it's more of working through how to do it, teaching yourself to do it.
Yes. And again, it's awkward when you are first
Mm-hmm.
starting out. It doesn't feel natural. It doesn't feel authentic. It can feel very awkward. But with practice, as we just naturally start to approach things that way, then it will feel more automatic and it will become more authentic because it will be how you approach problems.
So we are out of time for episode 1. Thank you for
All right.
joining us for this episode of The Power of Positive Thinking. We hope you now have just a better understanding of the principles and benefits of positive thinking. Make sure to check out episode 2, where Erica will walk us through just some more practical strategies for how to really incorporate positive thinking into our daily life and clinical practice.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.